And now to Somalia, where a devastating wave of a serious bacterial infection has struck the country's healthcare system to the core, with medical facilities now overwhelmed. The wave comes after the U.S. government cut funding from critical health services through Usaid, leaving the situation more dire.
Somalia is now grappling with a growing diphtheria outbreak, a serious, highly contagious and potentially deadly bacterial infection, which typically affects the upper airways, forming a thick membrane that blocks breathing. Now hospitals are overwhelmed, exposing gaps in the country's healthcare system. According to the World Health Organization, diphtheria spreads through coughing and sneezing and can be fatal in up to 30% of untreated cases, especially among children.
Diphtheria claimed the life of one of my children, and another fell ill but fortunately recovered. Now, I'm in the hospital with my two other children who have contracted diphtheria.
At Damatino Public Hospital in Mogadishu, children with swollen necks and breathing difficulties lie on beds as nurses and doctors administer medication, the hospital being one of several struggling to respond to the surging cases.
We need antibiotics and other medicines and labs for diphtheria. We need these elements and resources to save children with breathing problems due to diphtheria. We need these elements for life-saving, to save children who are in critical condition.
The outbreak comes at a critical point where U.S. aid commitments to Somalia fell to $149 million this fiscal year, down from $765 million in the previous year.
The U.S. aid cut terribly affected the health funds it used to provide to Somalia. Many health centers got closed. Mobile vaccination teams that took vaccination to remote areas lost the funds and now do not work.
In response, the Ministry of Health has announced plans for a nationwide vaccination campaign and a public awareness drive, including media outreach and engagement with the civil society groups to encounter misinformation. Hilda Kipto, NTV.